Hey there, dental daredevils and plaque pioneers. Ever wondered what would happen if you just stopped brushing your teeth? Like for a whole month? Well, buckle up, because we're about to embark on the great no-brush adventure, 30 days to a dental disaster. Our brave, or perhaps misguided hero decides to toss their trusty toothbrush aside. No more minty fresh mornings, no more fluoride foam parties. Just freedom, or so they think. Days 1 to 3. The invisible invasion starts. It begins subtly. Within hours of the last brush, tiny bacteria, always lurking in your mouth, begin forming a clear, sticky film called plaque. Think of it as their cozy, new apartment complex. Sugars from your food become their favorite fuel, and they start producing acids. So what's happening? From days 4 to 7, it is the acid attack. These acids are like tiny wrecking balls to your tooth enamel, the super hard protective outer layer of your teeth. They start to demineralize it, pulling out essential minerals like calcium and phosphate. This makes your once shiny enamel look dull, even a bit chalky. You might notice little white spots, the first visible signs of trouble. You could even start feeling sensitivity, especially to sweet things. We have made it past the first week. From day 8 to 15, the plaque party gets crusty. If plaque isn't removed, it starts absorbing minerals from your saliva and hardens into tartar or calculus. It usually accumulates around your gum line, but without continuous brushing, it can get deposited on the other surfaces of the teeth too. This stuff is like super cement for bacteria, creating rough surfaces where more plaque can stick. And those acid attacks? They continue, creating actual tiny holes, the beginning of a cavity. What started as a tiny white spot can now be a light brown discoloration. Somehow we have made it to day 30. As cavities deepen, they break through the enamel and reach the dentin, the softer, yellowish layer beneath. Dentin is full of tiny tubes leading directly to the tooth's nerve. This is when you might start feeling sensitivity to hot, cold, or sweet foods. That little cavity is growing into a serious problem, and the brown or black discoloration becomes much more obvious. Oh, did we forget to mention what's happening in the gums simultaneously? Gum giggles turn to grumbles. Those plaque bacteria aren't just attacking your teeth, they're setting up shop right along your gum line. Your gums, normally a beautiful pale pink, start to get irritated. They might look a bit redder and perhaps feel a little tender. This is the very first stage of gingivitis, a fancy word for gum inflammation. You could call the second week the bleeding edge. As the plaque continues to accumulate, your gums become even more inflamed. They'll swell up, becoming puffy and much darker red. Now even a gentle touch, or even just eating something firm, might make them bleed. And bad breath? Oh, it's definitely moved in as a permanent resident. What's happening to the gums from days 16 to 30? It is the perio problem. If gingivitis isn't reversed, and without brushing, it definitely won't be, it can progress to something much more serious, periodontitis. This is where the infection spreads below the gum line, attacking the bone and ligaments that hold your teeth in place. Your gums will start to pull away from your teeth, forming pockets where more bacteria can hide and wreak havoc. The supporting bone literally starts to dissolve, potentially leading to loose teeth and eventually tooth loss. That's not so fun anymore. Did I forget to mention what happened from days 1 to 30? Beyond the bite. Hold on a minute. Our mouth isn't an island. All that inflammation and those millions of bacteria hanging out in your mouth can have ripple effects throughout your entire body. The chronic inflammation from advanced gingivitis and periodontitis means those bacteria can enter your bloodstream. Once in your system, they can travel to other organs. Studies suggest a link between poor oral hygiene and an increased risk of serious systemic conditions. Heart health. These oral bacteria have been found in arterial plaque, contributing to hardening of the arteries and increasing the risk of heart disease and stroke. There could be various complications. For diabetics, oral infections can make blood sugar control much more difficult, creating a vicious cycle. Bacteria from the mouth can be inhaled into the lungs, potentially leading to respiratory infections like pneumonia. Emerging research even suggests links to cognitive decline and conditions like Alzheimer's. Chronic infection can put a strain on your immune system, making you generally feel unwell and prone to other illnesses. You might experience persistent bad breath, a bad taste in your mouth, and even difficulty eating due to pain. So, after 30 days of neglecting their brush, our adventurer isn't just dealing with a mouthful of rotten teeth and bleeding gums. They're potentially facing a whole body health crisis. The moral of our great no-brush adventure? Don't try this at home. We don't want all your teeth to fall out eventually, right? Brushing twice a day, flossing daily, and regular dental checkups aren't just good advice. They're essential for a happy mouth and a healthy body. A healthy, smiling mouth. So grab that brush, make friends with your floss, and keep those pearly whites and your entire body shining bright. Your teeth and your heart, lungs, and brain will thank you for it. Happy brushing.